Hello, and welcome to one of our 11 Together to Go Plank Mentor webcasts. Today we'll be hearing from Valerie Spier of Sutter Health. Valerie is the Plank Mentor for the Refer to DSME and Support Programs campaign Plank. Valerie, thank you so much for joining us today.
Thanks so much for having me. I'm really excited about this campaign.
Great, so let's get started. Why don't you tell us a little bit about you and your organization?
Sure. Yeah, Sutter Health is a really large medical system. We have a coverage over about 100 different communities in the Northern California area, and we service the patients in a wide variety of settings such as hospitals, surgery centers, multi-specialty practice clinics. We even have hospice care. So we have a lot of different services that we offer. I've personally been with the Sutter Health system for about 15 years, and I originally started at the Palo Alto Medical Foundation as a certified diabetes educator, registered dietitian. And I started about 2 years ago in my quality position at the Sutter Health system, and really could not be more thrilled with the work that I've been able to do on this Together to Go campaign.
Great, so tell us a little bit about why Sutter Health developed a program aimed at increasing referrals to DSME.
Sure. Yeah, there were several different planks, which of course we thought were really important and we are already doing some work on. And when we considered the referral campaign, it was just so important to us because we had realized when doing our annual accreditation work for AADE, our diabetes education programs were showing a decline in the number of patients we were seeing every year. And that didn't make sense because we knew that the Sutter Health system was actually growing and we were serving more and more patients every year. And so it didn't really make sense to us that we should be seeing fewer diabetes education patients. And so this really was something that we felt a real important way of helping to connect those patients with the services that we offer.
Great. So what would you say were the one or two most effective strategies you employed to increase referrals?
Yeah, I think the most important is really making those connections with the doctors and that face-to-face visibility of going out either to their meetings or catching them in the hall or going to their huddles and reminding them about what diabetes education can offer to their patients. You know, we found that a lot of the doctors, even those who had been with us for quite a long time, really felt that diabetes education was just at the first initial diagnosis of diabetes and one and done. You know, once they got their education, they were good. And so it's really taken a lot of work, and we're going to continue working on just helping doctors to understand all those different times that a diabetes educator can be of use, you know, those 4 times to refer. And I'd say the second thing that we did that was really important was really going out and marketing. So we created a brochure that went over the diabetes education system and, you know, what we could do, the services that we offer. And we've placed those brochures in lobbies, in urgent cares. We've done some direct mailing. We've given them to patients to hand to other, you know, family members and friends that they have, you know, awareness of diabetes where they haven't had education yet. So we really feel that the visibility and the marketing has been so important.
Great. So what obstacles did you face and how did you overcome them?
Yeah, I'd say the biggest obstacle really is that the Sutter healthcare system is so large, so vast, and each of the affiliates has their own operating systems, their own ways of doing things, which we've really been working together to try and unify and standardize across our system. But I think one of the things that, you know, anytime we try and create a big change in a system, change management is really important. And so I personally had training with PROSCI, it's PROSCI, in something known as ADKAR, ADKAR. And so when you're working with an individual or a group, it's important to assess where they are in the change process. So ADKAR stands for awareness. Do they lack awareness? Are they even aware of, you know, why they should refer? Knowledge, you know, do they know how to refer? Desire, do they want to make that change? You know, do you maybe need to plant a seed of why it's to their advantage? Ability, do they need more skills? Do they need to know how to connect to those people? Do they need to know how to submit an electronic referral? And then reinforcing and just continuing to train, retrain, remind. And I think that ADKAR nomenclature is so important for helping to keep the change management really pertinent to the team or the individual that you're trying to influence, because people really resist change being done onto them, but they don't necessarily mind change when they're part of the process. So I think it's really important that we be very sensitive to where somebody is in that change process.
Great. So I think many will want to know from you, how did you measure your program progress and what were the results?
Yeah, we had two different ways of measuring it. We locally measured the teams and their referring doctors through our accredited program. And we found that we had been able to achieve about a 7% growth from 2018 to 2019. And our bar was set at 4%. And keep in mind that the year prior, we actually had negative growth. So that was really a great success. And that was directly related to the work that the education teams were doing to own this When to Refer campaign. The system-wide change was measured by the Together to Goal data team. And they looked at, of all the patients across the system who had diabetes, how many had been referred and how many were actually seen in education. And what we found was that the referral rates actually varied from 5% to as high as about 25% at some of the affiliates. The scary thing was that, or the disappointing thing, was that the patients really weren't necessarily coming in for the diabetes education services. Some as low as 2% being seen in diabetes education, and not uncommon to see just 15% of those referred actually being seen. So we still have a lot of work to do around getting those patients in and reducing those barriers.
Great. So our last question for you today is, what is the most important thing that a medical group or health system should know before they tackle this campaign plank?
Yeah, I think it's really important to recognize your champions, find out what the barriers might be in the organization. Really, what are the resources do you need? You know, it's IT, sometimes it's partnerships. You might need some volunteers, some creative services. We relied very heavily on the AADE's published referral to help make our paper referral. And also we used their template to also design our electronic form to make sure that it contained all those components. So having maybe some templates and some standards to go off of, but really it's all about the people getting the work done. So really forging those relationships and patience. It does take a lot of time to affect change, probably more than you think it's going to.
Great. Thank you so much, Valerie. This has been wonderful, and we appreciate you taking the time to be here with us today and share these great insights with our other Together to Goal campaign participants. As a reminder to fellow participants, if you'd like to contact Valerie to discuss implementation of the Refer to DSME and Support Programs campaign plan at your organization, please email t2gmentor@amga.org. Check out our remaining Together to Goal Plank Mentor webcasts on our website to discover what other experts have done to improve diabetes care across the country.